Good morning, everyone. This is Bill Keegan, Town Manager in Foxboro, with your latest COVID-19 update for the May 28th, Friday, May 28th. I hope everybody's enjoying their day so far. So let's go to the numbers. So today we have a total of 107 cases that have of COVID-19 that have been determined to be positive in Foxboro since March 15th. We have a total of 80 that have recovered. 16 people are currently active with COVID-19. That's up another one, just one case since yesterday. Up two, I think, for the total for this week. So not a significant jump either way. Total of 10 people have been lost in the follow-up phase, and 833 people have tested negative. So obviously, more people that are being tested, we're going to find a few more that are currently active. So we will continue to keep tabs on that very closely. 2 people are hospitalized. That number has stayed steady all week, and so we're not seeing any significant jumps either way in that situation. And 1 person has died as a result of COVID-19 complications. In Norfolk County alone, we see that there is a total of 7,880 cases of COVID-19 that have occurred. 794 people have died. Roughly about a 10% impact in terms of those people that have had cases in Norfolk County. Overall, in Massachusetts, the numbers are around 94,220 cases, and at this point, 952,144 cases individuals have been tested. Pushing close to the 1 million amount that has occurred here in Massachusetts in terms of being tested. So that's actually a significant number and really important for the follow-up phase as we enter the multiple phase reopening steps for Massachusetts. In terms of the number of beds available, 17,500 beds are available currently. 2,112 people are currently occupying those beds. And 526 people are in ICU at this point. Those numbers have trended downward all week, and so it's good to see that those numbers continue to head in that direction. So it's good to see that as well. Let's take a look at the report today, and just a couple things on the local front that folks need to be aware of. We do have a we do have a water ban in place. It's a temporary one. We do have a couple day ban that's typically in place for this time of year, but right now we have a full water ban in place because we had experienced a major water break last week, and as a result, the tanks were really impacted by that. So we really have to rebuild the tank capacity, and so the water department has put the water ban in place for a few weeks now, just so we can get those tanks back up to where they should be. So we apologize for that inconvenience, but we want to just make sure that we maintain the proper pressure throughout the town for obvious reasons, that we have provided enough water, safe drinking water for everyone in the town, and also that we provide enough water pressure for suppression if in case we ever had experienced a fire or a situation like that. So it's really important that we put this in place in order for the safety of everyone in place. So just a reminder that the town of Foxboro has plenty of water supply. That is not an issue at all, but we are limited in terms of how much we can actually take out of the ground per the permit that the state issues each city and town across the Commonwealth. And while it gives the impression that we don't have enough water, we certainly do. We are limited by the amount of water we can take out of the ground. So just a reminder, we do have that watering ban in place. That means no outdoor watering during the week, and I know that some folks are looking to open their pools. That will have to be done privately under the circumstances, and also people like to water their lawns. And unless you have a private well, obviously that's really not appropriate to do at this point in time. So water your flowers, with a watering can as opposed to using the hose. So obviously be careful about overusing any kind of water that will impact the well level at this point in time. Just want to get that word out to you this morning. Also, just a congratulations again to all the seniors. I know that yesterday was their last day. Some folks may have witnessed the fact that there was a big drive through the town yesterday. And purposely, we did not advertise that because we didn't want to get a situation where we were causing crowds to collect along the side of the road. As obviously we had just not conducted our most recent Memorial Day parade, so we did not want that to turn into a crowd collecting situation for COVID-19 purposes, obviously. So, but it's still just the same. I want to congratulate the seniors for graduating and making it through will certainly be an historical year for seniors and students graduating from their high school classes and college classes, for that matter. So I want to say congratulations. It's unfortunate that you had to experience some of the impacts that you've experienced, but we've done the right thing to try and keep the community safe overall, and you've all been an important part of that. So thank you, and best of luck to all of you, the graduating seniors, both high school and college, or graduate school for that matter. If you graduated this year, congratulations, and hope that you move on in the right direction, secure the right job, secure the right college, and secure the right course of life that you have going forward. So best of luck to all of you. Let's take a look at the local report. Yesterday, Governor Baker and Lieutenant Governor Polito joined Health and Human Services Secretary Mary Lou Sutters and Energy and Environmental Affairs Secretary Kathleen Theorides to discuss recent investments to improve food security during the COVID-19 outbreak. Last week, the administration announced $56 million to combat urgent food insecurity to fund several initiatives, including $36 million for COVID-19 food security grant program. Also last week, the Department of Transitional Assistance announced that the USDA approved Massachusetts' plan to join an online EBT grocery program. These initiatives, along with a number of other efforts, are consistent with the findings of the Food Security Task Force. The task force developed recommendations in 4 key actionable categories. They are develop and implement an emergency food program, 2, fortify the food bank system, 3, maximize federal resources for food and nutrition, and 4, reinforce and redeploy the food system infrastructure. The administration is also implementing a special food benefit for children called Pandemic EBT, or P-EBT, which will be delivered to the thousands of the 500,000 plus children who received free and reduced price school meals across the Commonwealth. Additionally, Shaw Foundation, DTA, and Project Bread launched www.map-ebt.org to house all the information on P-EBT and outreach materials. An additional map of resources is available as well. MEMA, together with Mass VOAD and other partners, has developed a COVID-19 public resources map showing the location of resources available to the public, such as food and banks, houses of worship, and Project Bread site locations. Please note that this map is not inclusive of all resources, is only as accurate as the information that has been provided to MEMA. In coronavirus testing and response, the Department of Public Health has indicated that there are 94,220 confirmed cases of COVID-19 in the Commonwealth, with 527 new cases and 74 deaths as of yesterday at 4 o'clock. The average new cases over this last 7 days is 750, and the average number of deaths is 69. 7.9% of the 6,663 tests reported yesterday were positive, with a 7-day weighted average positive test rate of 8.5%. 2,106 individuals are hospitalized with COVID-19 statewide, and that's a decrease of 2 from yesterday. Actually, on Tuesday, rather. The Department of Public Health regularly releases a daily reporting dashboard, which you can all access online. And hospital capacity as of May 27th, 54% of the Commonwealth's 17,500 permanent and temporary beds are available for new patients if needed. Long-term care as of May 27th, there are 348 long-term care facilities with at least 1 case of COVID-19 and 20,267 staff and residents in facilities who have tested positive for COVID-19. 4,041 of COVID-19 deaths have been reported in long-term care facilities. That's one of the biggest impact areas in the entire Commonwealth. On the economy and workforce front, we are increasingly hearing reports of those taking advantage of the COVID-19 pandemic to file fraudulent unemployment claims. The Department of Unemployment Assistance has set up a dedicated online reporting system for reporting fraud. If you have reason to suspect your identity or business has been impacted, being used to commit the unemployment fraud, please contact the department immediately. On the education front, following yesterday's Board of Elementary and Secondary Education meeting, the Board adopted the Commissioner of Education's recommendation to modify the MCAS testing schedule. Most notably, the new schedule will allow 10th grade students who could not take MCAS this spring. They can now take the corresponding tests in grade 11 to ensure that all students can graduate on time. On the transportation front, the MBTA continues to operate reduced services for subways, commuter rails, and buses, and is making schedule adjustments designed to prevent crowding that could occur as summer construction on several lines begins. The RMV is in the process of developing online learner's permit exams for student drivers by mid-June. Currently, learner's permit exams for Class D and Class M licenses, standard drivers and motorcycles licenses, are not available at RMV service centers. More information about licensing, extensions, and other impacts of COVID-19 can be found online at the RMV. Legislatively, the governor signed legislation providing critical relief to the unemployment insurance program. The bill includes an extension of the maximum allowed claims period from 26 to 30 weeks for any week in which claims exceed 100,000. A provision exempting employers' experience ratings from impacts of COVID-19 in the current state of emergency, and lifts the cap on benefits for those with dependents. Yesterday, the State Senate adopted rules for conducting formal sessions remotely to allow for full roll call votes. The House adopted remote session rules earlier this month and has held 3 full formal sessions remotely so far. And then on some additional items, the Franklin Park Zoo and the Stone Zoo will be reopening to the general public on June 4th with health and safety measures in place. More information on the measures being taken and full reopening schedule can be found at zoonewengland.org. The Department of Public Health also releases weekly reports on town-by-town COVID-19 case numbers and rates, and resources for residents experiencing job loss or loss of income. You can go to the mass.org sites on the Department of Unemployment Assistance for help in several different areas. Department of Transitional Assistance also can provide that, so help there as well. So at mass.gov/DTA/COVID-19 resources and support. And how can you help? The American Red Cross is looking for blood donations as always. 1-800-RED Cross. Please keep in mind that a lot of their blood donation drives have actually been canceled due to COVID-19 concerns, and therefore blood donations are critical at this time. And finally, everyone is reminded that the safer at home policy is in place now, and also face coverings are required. We actually disclosed our plans for reopening this past week. We have not opened our doors formally to the public, but we are in the process of looking at a schedule to do that. Face coverings will be required in the building at all times. Once you enter the building, you will be required to have one, and so that is one major important point that the public should be aware of when they do enter the building once we do reopen. And we will be notifying you per these announcements in the morning as soon as we have a firm date as to when it's going to happen. All right, so that's the latest information that we currently have for you here in Foxboro. There is so that information gives you the local update as well as the update from the state and federal government levels. If anyone has any concerns or questions, if they want to send me an email at wkeegan@foxboroma.gov, happy to respond to you in as timely possible, in a timely way as possible. I am going to be out of the office tomorrow, so I will not be broadcasting tomorrow morning with a live update. I will hope to be back to you later in the day. So I wanted to just let you know that I'm going to be out of town tomorrow for the next 2 days, but I'm hoping to do an update on Saturday and as well on Sunday, but will not be broadcasting to you live tomorrow morning. So just want to make everybody aware of that, and hope that you continue to enjoy your week and the weekend as they approach, and hoping you enjoy some of the warmer weather that we're starting to experience, more seasonal periods as we get through this. And so one person has asked a question about the question of ICU and who's actually in the hospital. We do not have specific information about individuals who are in the hospital. We only have the general data. We're not allowed to talk about individuals or individual cases. That's information that is protected by federal and state laws. So we can only give you numbers at this point in time, hoping to see that though that anybody who has been hospitalized is put into a step down stage, if in fact that is the case, because we certainly want to see those folks get better as soon as possible. So that is the latest information I have. Again, enjoy your week, enjoy your weekend, and I'll see you next time. Hopefully on Saturday. If not, I'll definitely see you on Sunday morning. Everyone take care until then. Bye now.